Well, welcome back to our Department of Labor and Economic Opportunity webinar series focusing on workplace mental health. As you all know by now, there's a Q&A box on your screen that you can submit questions to at any time throughout the presentations today, and we'll get to as many as we can at the end. And if you haven't already, as I always remind you, please make sure you sign up for emails on our michigan.gov/workplace mental health page. This site will also include the recording of today and other recordings that we've done for webinars. You can always go back and check those out, as well as corresponding materials that some of our guests may provide. You can find our report, the Surgeon General's report, and more information on that website, so make sure you take advantage of that. And as you all know, our goal is to provide working people and employers with information about issues impacting our workplaces, the impacts to our mental health, and options for addressing these issues. So as I've shared before, when we look at our work, we're really focusing in on those three pillars, which are things that are in the workplace characteristics that could be causing challenges, things affecting the workplace, recognizing that we're all individuals with different backgrounds and we're going to be carrying different types of experiences with us. And then certainly those individual behavioral health supports, because it's on all of us to make sure that we take the steps that we can to improve ourselves. Sometimes we don't know that, and that's something we'll talk a little bit about today, but make sure that we have all those pillars covered. So we try to make sure we hit on all of these throughout our webinar series, and today kind of covers all three of them in some way. So we're really excited about that. So as we've been developing this work, we've made a lot of great connections with various groups, educators in these spaces, researchers, and more, and have discovered a few training opportunities that are relatively what I would call simple and definitely cost effective to do, but have a big impact on the overall workplace and overall well-being for employees. So among these, we found this actually through our friends at the Great Lakes Bay Regional Partnership to begin with, is this concept of mental health first aid. Now, for workplace safety and health folks, we know that we do first aid training all the time for physical injuries, but thinking about that from the lens of what do we do for mental health, this is really eye-opening for us. And we had about 30 of us from our department that went through this training, myself included, and became certified. We did, there's various types of mental health first aid training. So we did what was called the community-focused training. That's a little broader than just what you might find for the workplace, but they have workplace-specific training, industry-specific trainings, and other tools out there, as well as different age groups, some for higher ed, some for lower ed, some for kids and teens, like all of these great things. And it was really eye-opening for me going through that training and, thinking about one of our instructors talking about, if I came into work and my arm didn't work, you would all be thinking like, what's wrong? Are you okay? And you'd be we'd all be very helpful and very concerned. But if I came in and said, I'm suffering with depression, none of us really understand how to respond to that. So this helps. This helps people understand, helps those that become certified, connect people to resources. So today we're joined by my now good friend, Rob Rader, with the National Council for Mental Wellbeing to tell us more about this program. But I want to note, in your original invite, our original presenter today on this topic was Rob Valentine. He's a trainer across the country in workplace and community mental health first aid. He's tied in with that Great Lakes Bay Regional Partnership, and he did a big portion of the training that those of us in Leo received. We got a message from him this morning that he had a family emergency, so just want to say that we wish him and his family all the best if he's happening to tune into this, but certainly happy to have Rob Rader kind of backstop Rob Valentine and join us today to share with you all this really, really cool tool we found called Mental Health First Aid. So over to you, Rob. You're still on mute.
Got it. Thank you, Sean. I appreciate the opportunity. I'm certainly sorry it had to come under these circumstances. I hope everything's okay with Rob, but appreciate the opportunity to speak to you all about mental health challenges as they show up in the workplace and some of the things that you can do to be proactive and engaged with your colleagues, with your employers, with really anybody. Anybody can be a candidate to go through mental health first aid trainings, as Sean mentioned. And I loved what he said about if someone comes in with a problem with their arm or limping, or right away we notice, right? We see that. And we don't try to cure it or diagnose it, although maybe sometimes we do. But we certainly want to help, right? We want to help with well, maybe you should go to urgent care, or maybe you should see your doctor or get an x-ray by an expert. And that's really what the whole point of mental health first aid is to recognize the signs and symptoms of mental health challenges, uh, both in the workplace, in the community, wherever it might be, wherever it may show up, and be able to offer resources and assistance. So you should all be very proud of the work being done in Michigan right now, specifically Sean's group in bringing these trainings, and the work that they're doing is just absolutely something to be proud of, and we are proud to be just a part of it. So I will go ahead and just walk through a few slides that talk about who we are as the National Council for Mental Wellbeing, what mental health first aid is, what it isn't, and how specifically it applies in the workplace, because that is very different than mental health challenges show up anywhere else. The way they show up in the workplace is a very different thing. So let's talk a little bit about some of the challenges that you all have in your workplace, whether you are an HR person, whether you are somebody that works in an office setting. You've all seen things, and things happen, and there are things that come up. How do we approach them? And so the health of an organization is so much more important than revenue and profits. The employees and their well-being and their resilience is so important to organization success, whether you be in the public sector or private. Employees can have a range of experience and backgrounds and cultures that they bring. And so how do you offer support? How do you offer support as an organization? How do you offer support as a colleague? How do you offer support as a people team, as an HR team, and keep folks kind of moving forward? 94% of the CEOs that we have talked to believe that health and wellness programs are essential to recruitment and retention of top candidates and top talent. When we see unhealthy workplaces, they have incredibly high rates of turnover, folks looking for other opportunities, for organizations that are finding ways to show that they care about their employees' well-being from the top down. And so the biggest part of this, and you'll hear me mention this word a lot, is stigma. Most of the employees we talk to, about 75%, say that stigma is the barrier for them sharing their mental health experiences, accessing any resources or care that may be available to them through either employee assistance program, EAP program, or maybe even health benefits, whatever that looks like. That stigma in the workplace, where you feel like if your boss finds out, or if other people find out, it's going to be a problem and they're not getting the help they need. And the brain is no different than any other organ in our body. The longer we let these things go, the worse that they get. And one of the things that I just want to share with you really quick, that is always an eye opener for me, the length in which it takes folks to get help for mental health challenges is a shocking average of 10 years. Now, I'd like you to just for a second think about if you fell down your stairs, or you tripped off the curb and you were bleeding, or you felt, you twisted or sprained your ankle. Imagine waiting 10 years to deal with that. Or high blood pressure, waiting 10 years to address that. So mental health challenges have a very different stigma out there, not just in the workplace, but everywhere. So let's talk a little bit about who we are and why you should listen to us. We are the National Council for Mental Wellbeing. We are a nonprofit association serving more than 3,400 now mental health and substance use treatment centers across the country. So if you've ever heard of certified community behavioral health centers, that is our organization. We serve those members. We serve the folks working out there to deliver those services, and those are treatment organizations. So what we're talking about when we talk about mental health first aid is really a proactive approach. How do we learn about mental health challenges? How do we learn the resources and the things available to our colleagues and our friends before we get to that point of needing treatment or having been diagnosed? So through our program, there's almost 3.5 million people now trained in mental health first aid. The vision of our organization, as you can see here, is about making mental health a reality for everyone, mental well-being a reality for everyone, and being able to live and thrive with a mental health or substance use challenge. Right now, the goal is 1 in 15 people across the country, with the thought being that if you've got 1 in 15 people trained in mental health first aid, odds are everyone is going to have one person in their circle of friends and family that can help them in a crisis. So just some numbers here, they're kind of stark. We're losing people every day that die by suicide. This 1 in 5 number post-pandemic is probably more like 1 in 4 now, but that is also diagnosed. So living with a mental illness means they've been diagnosed. How many folks are walking around that have not been diagnosed because of the stigma we talk about, because of the access to care, because of the lack of knowledge of resources? So that 1 in 5 is stark. Odds are when you look around a room, somebody is either struggling or may have been recently struggling or maybe about to be going through something. How do we help them? Let's talk about that a little. So there's some other stats here. I know that they'll make the slide deck available for you. But again, here's that 75% number that I mentioned about stigma in the workplace. It's stark. These numbers are stark, and we're working to help bring them down. So the unique value of mental health first aid at work is building that awareness, that understanding, those skills. It is, again, not going to teach you to diagnose or treat. That takes letters after your name that take a lot more than 6-hour training to be able to do or to be able to deliver. So what it's meant is to understand how mental health plays a role in the workplace. Being able to respond to a person that is potentially going through something or struggling. Maybe they just need to talk. Maybe they need something more than that. Maybe they need the ability to reach out to some professional help. So mental health first aid is research informed. There's been a number of peer reviewed studies to give people the confidence to help one another, to change the way we talk about mental health challenges as well. The language that we use goes such a long way to creating a level of comfort and removing that stigma. And we'll talk about that in a minute too. But it's trusted by companies all over the country, public sector, private sector. We work with several counties across the country to deliver to those working in the county setting, government setting. And it's developed and delivered by experts. We mentioned earlier Rob Valentine. He's one of those experts that is out there as a mental health first aid at work national trainer to be able to deliver these trainings. And the fidelity of the curriculum is assured by having these experts out there delivering them to organizations like yours. So what are some of the lessons learned? We have been doing this with mental health first aid at work since about 2017, with about 60,000 people to this point trained in mental health first aid. And so, or 60,000 rather, sorry. So what we've learned is that when you make an objective to lower the stigma around mental health, it really helps to create that culture within your organization or within your circle of comfort, of resilience, of the ability to confidently handle situations that might arise. So when our organizations that we work with make it an objective from the top down, that's when they see real culture change. When you've got the executive team moving things forward, messaging on a steady basis, it makes such a huge difference to the employees to know that they are cared about, they're cared for, and it keeps the conversations going as well, which is really important, especially post training when you go through mental health first aid. The curricular language, it needs to be appropriate, and so we talk a lot about the way that we talk about mental health challenges and how it reduces stigma and changes the way we see things. The terminology and the phrases, it's in lay terms, right? This is not meant for professional mental health experts. This is meant for everybody. This is meant for anybody that either has some knowledge of mental health challenges or no knowledge at all. It enables us to understand it and to be able to talk about it with our colleagues. And the other piece too is it can be virtual, it can be in person, it can be a hybrid. So big companies, there may be some folks on this call that have multinational companies, and there are other mental health organizations across the globe delivering to about 25 countries now mental health first aid. So we meet the employees where they are, whether that be an in-person in a big auditorium to teach the training, or virtual on their computers and devices. So being able to highlight those resources while using mental health first aid at work makes a very big difference in being able to apply what it is that they're learning. So prioritizing mental health before you find that it hits the bottom line of a company or an organization, because there are billions of dollars lost every year in folks taking off work for mental health reasons. My apologies. So increasing productivity, creating a positive culture, that embraces mental well-being and continues that conversation with employees and supports those that need it is really important. Implementing those best practices for both self-care and professional care and building that resilient mindset. We hear the term resilience all the time. When we talk about resilience, we're really talking about mental resilience and creating that in the workplace. And build a common and approachable language. That's at least the third time you've heard me say language. Language is such a big part of this. And just to give you a quick example, historically people have used the term when we talk about somebody taking their own life. You've heard committed suicide, right? Well, now we're very careful to talk about suicide differently, and instead we say things like that person died by suicide. You'll see that in the media now, died by suicide or took their own life. But again, you're talking sometimes to people that have a lived experience, and you do not want to stigmatize it. They might have had a family member that go through something, or maybe they've been through something. So again, the way we talk about it makes a very big difference. So mental health first aid at work has incredibly high levels of high recommendation rates and great outcomes of creating that confidence to help one another. You can see a few testimonials here, which I won't read to you, but you can always take a look at them in the slide deck later. 98% of the folks that take mental health first aid at work would recommend it for their colleagues. So it's well received. People take the training, and all they want to do is learn more and talk more, and it just it opens up that culture. So at the heart of mental health first aid, whether it be mental health first aid at work, or as Sean mentioned before, adult and youth, or teen mental health first aid, and there's a whole lot of other things that that mental health first aid encompasses. But let's look at this real quick, because this is called ALGIE, and it is a nonlinear sort of mnemonic that allows us to simplify the steps in being able to help someone. And so the A in ALGIE is approach. How do you assess somebody for risk, whether it's self-harm or potential suicidal ideations? How do you listen non-judgmentally? We all bring our own cultures to everything we do, individual cultures. And so how are you able to listen non-judgmentally and make sure that you're offering that support? And then give reassurance and information if someone might be going through something, regardless of what it might be, regardless of whether it's a crisis or not. How do you give them reassurance and provide them with information? Every organization, again, I mentioned earlier, has an EAP program. You have benefits, you have access to care. And sometimes when you're struggling, when you're in crisis, is the worst time to try to find those resources. So this provides you with some of those resources and awareness. And then encouraging, there's two E's there. Encouraging self-help, which could be something like, take a walk around the block more often, get exercise or read a book, or could be anything that we think is self-help for our own mental health and our own mental well-being. And then there's also encouraging professional help. Determining, once you've gone through this process, it could be a crisis, it could be somebody struggling. Maybe you do need to call 911 or bring in a supervisor or whatever that looks like. It really runs a range of different things, or a spectrum of how to provide help. What the training does is it helps you think about your workplace policies and procedures, the resources that are available, the community resources that are available, and allows you to provide that help to your colleagues and to your coworkers. So that's the ALGIE 5-step action plan. These are just some additional benefits, which again, I won't read to you, but there's so many great things that come out of employee and workplace mental well-being. But being able to address that gap between recognizing mental health and substance use concerns and accessing treatment that they might need, that's one of the things that always stands out to me. And how you can help a colleague who's struggling. It's a great feeling when you can help someone. Apologies. So I'm going to just touch on this very briefly. I think I've got a few minutes left. So how do we do this? How do companies, how do businesses, whether they be small or large companies, and we'll talk about some of those that we work with, how do we deliver these trainings, and what do they look like? And so these are the products we have available right now. Intro is a high level overview of mental health first aid. It can be taken by anybody. It is 2 hours. And it is something we recommend for organizations, really to educate everybody at that level. Then you have certification. Certification is usually for supervisors and HR folks and people that really want to walk away being a mental health first aider. They become sort of the workplace resources for folks, people they can go to talk to. And that leads us to Champion. Champion takes those certified in mental health first aid and allows you to create networks in your organization, whether it be, if you're an individual, you can have colleagues that you work with to create monthly meetings and monthly webinars, kind of like this one, where you're promoting these kinds of things and promoting the learning. And then Transform is really for HR professionals and leaders to kind of help change that strategy of how you deliver mental health trainings to your peers. And so this is a description of this. Again, this will be in the slide deck, so I won't read these to you. But it is a bottom-up approach where folks can take a very basic intro to mental health first aid, learn about what it is, non-crisis situations, how do you help, then certification, and then Champion and Transform. So it is a multi-step process. It is meant to be a what's next approach. How do I learn about this, and then how do I apply it, right? And that's where this comes in. What does it mean to be a first aider, and what am I going to do with that once I'm trained in mental health first aid? Whether you go out there and find courses in the community as an individual, or whether the workplace brings it there for you, these are the ways first aiders show up. Initial points of contact for folks that might be struggling. So you are trained in resources of the organization. You've gone through mental health first aid. You understand what it is and what it isn't, and you're able to help when somebody is struggling. Communicating the value of mental well-being. That is another part of this. All of these stats we've shown, there's a value to showing well-being in the workplace and creating those resilient workers. And then helping to destigmatize. There it is again. I knew that was going to come up again. Conversations about mental health and substance use, conversations, making it comfortable, creating a safe place for it, and allowing people to feel like they can talk about what they might be going through. Participating in meetings to respond to challenges and issues. So if you're a mental health first aider and you're in that workplace environment and you've got an HR team that's really looking for people to help contribute to that, you are who they're going to want to be part of that, to reach out to employees and provide those resources. And then anytime you have mental health first aid at work events, you are the person as the one that's gone through mental health first aid and been trained in a first aider to promote that to your colleagues and make sure that everybody is getting these trainings. So as I mentioned before, it is all over the world. It started in Australia and has spread all the way to the United States. We are the organization that delivers mental health first aid here in the US. If there are any multinational companies on this call, or we can always help make introductions if people are interested in learning more to other countries across the globe. These are just a couple of testimonials for the companies that we work with, the way people feel when they leave the trainings. Again, 98%. So for the most part, folks that go through these trainings, they want more. They want to learn more. They want to keep the learning moving. These are just some of the clients that we've worked with and continue to work with these mental health first aid at work products. Through retail, travel, and leisure, we're also starting a new module for restaurants. Working in a restaurant can be very taxing on your mental health, and so helping those folks identify the signs and symptoms of mental health challenges is important. Manufacturing across the country as well, some in your backyard. And so that's really the short of it. There's a lot more that I can talk about if anybody wants to listen. So you're welcome to use this QR code to schedule some time with me if that's of interest. You can reach out to me and I'd be happy to connect you with resources in the community, resources that can help. We have resources across this country that are delivering mental health first aid. There's 15,000 instructors across the country delivering adult, youth mental health first aid. Teen mental health first aid is happening in the school systems. And then we have about 6 or 7 community-specific curricula out there as well. So lots of resources, lots of great stuff on our website, mentalhealthfirstaid.org. Take a look at it. And if there's anything that I can do to help, I'm always happy to have this conversation, always happy to get this training out there. Very much appreciate the time given to me today to talk to you all. And I'm here for questions.
Absolutely. Thanks so much, Rob. I think one of the questions that we had come in is a good one, but just sort of to reiterate, having gone through at least the community training, this training is not about creating counselors. I'm not a counselor now just because I'm certified, but what in theory, I'm better equipped to recognize and kind of respond with resources for people and kind of maybe see some different changes in others. Part of it's just, frankly, just be a good neighbor, right? You're around people quite often. You start to see changes in behavior. How are you feeling? How are you doing? Is everything going okay? So one of the questions we got, the easiest question I'll answer is, and it's posted in the Q&A box if anybody needs the link. That website I mentioned that we have is michigan.gov/workplace mental health. And then we got a question in about, you could probably stop sharing if you want to, Rob. We just saw your baseball team, which is pretty cool, is about communication. So this person asks, how do you communicate with someone who may be experiencing issues in a way that isn't judgmental? Or how do you respond when someone becomes offended?
Yeah, that's a great question. And so all of the trainings that we have those kind of disclaimers and warnings that there are always going to be folks in the room that have a lived experience or have a reason why that particular topic could have an adverse reaction to it based on their experience. So, yeah, how you deal with that really depends on your own workplace culture. But I think as they arise, it's being prepared. It's making sure you've got folks that are in the room that can help folks in the moment, certainly take that aside and deal with it. I do think, and I mentioned this earlier, we all bring our own cultures with us and our own biases. So there are always going to be folks that the training may or may not resonate with for one reason or another. And I think how you handle that really is up to an individual HR team or workplace department. But I do think that we've seen it happen. We've seen situations where topics become a little hard for people to sit through. We make sure that ahead of the trainings and ahead of those important topics that people are given grace there. These are difficult topics. We all have our own lived experience for different reasons. And so we make sure that grace is there and that moment is there if they need to step out of the room, take a minute, and be able to address whatever it is that they might be feeling. So certainly address it, try to handle it in the moment, and then address it as a team as you come out of the trainings to see what maybe what maybe you can do to get out in front of that. So.
Yeah, staying on the communication thought, you mentioned how we are changing the way we talk about suicides in particular, but one of the things I learned in the training that you all do very well is just how we talk about mental health or mental health conditions overall. So in the past, we might say like, hey, Sean has depression.
Huh.
And how we change that. Can you share with everybody kind of how you change those? It helps change your way of thinking as well. Can you share some of those concepts?
Absolutely. So it's what we like to refer to as a first person approach when we talk about mental health. You would never say to someone, or here comes, depressed Dana, or you would never lead with that. And you would never do it with diabetes. You'd never do it, God forbid, with cancer or something serious. So why would we do it with mental health? And the reality is, you hear it, you see it, whether, and I won't throw the words out there, but you do hear it when it comes to substance use or diagnosed disorders like schizophrenia. We hear it out there, and the idea is to change this to a person-first approach to the way we talk about mental health challenges and certainly diagnosed mental health disorders as well. So this is Rob is living with depression. Rob is living with anxiety, or has had or living with suicidal ideations. The mental health challenge that we're going through does not define who we are. So it is that first person approach, put the person first. And it changes the way we feel, it changes the way we talk about mental health challenges. And there it is again, it removes that stigma.
Yeah. And it can really change the way that you think about people. I think one of the things too, for those that are trained, as you said, very important for everybody, you're not becoming a counselor, right, Rob? I mean, it's not intended for you to become a counselor.
Yeah, there are people that go to school for a lot of years to put those letters after their names, and to become a mental health professional, whether that be a someone with a master's in social work or other PhDs. They are out there, and of course psychologists and psychiatrists. They are out there to to diagnose and treat and help to treat mental health challenges and substance use challenges. We are not. Mental health first aiders are simply there to help provide the resources that might be available and raise that awareness for how easy it is to get access to care, because it's way easier than we think. And one of the issues that we have when we have these trainings, we ask employees, how many of you have the AP in your phone, in your cell phone? And the answer is usually very low number, if any. And the reality is, when we are going through a crisis, when we're struggling, our brain functions differently. And the ability to find the resources we need in those situations is very hard. So again, the proactive approach that mental health first aid provides helps to raise that awareness and give people the resources they need when they need it. So that's a big difference in the trainings.
Absolutely. Well, that's about our time for today. Rob Rader, just can't thank you enough for jumping on at the last minute to kind of share this important information. I certainly can suggest to those, at least from what we experienced with the community mental health first aid, certainly something we're recommending. We thought it was great. We're internalizing a lot of stuff that we learned, building those groups that can keep it moving forward. And it's been very, very helpful for us. And our goal this year really is to continue moving toward the sort of what do you do about it phase of this work. We have a lot of information about how big this problem is, but it's important that we find the tools that help people start to deal with it. So we'll be back next month. You'll get a follow-up email with the slides that Rob shared. Those will be posted on our website as well. And just thank you all so much for joining us today.